Peutz-Jeghers syndrome is an autosomal dominant disorder characterized by the development of benign growths in the GI tract. Peutz-Jeghers syndrome is also known for causing dark spots, not totally unlike those of a jaguar, on the lips, mouth, hands, and genitalia. In this video, we'll help you remember these details with a daring adventure to capture a rogue jaguar. Let's go! Jaguars are normally found in the jungles and wetlands of South America, but this jaguar, we'll call him Peutz, is a long ways from home. In this scene, Peutz the jaguar is feasting on some intestines in the African safari. Maybe he escaped from the local zoo. In any case, let Peutz the jaguar remind you of the disease Peutz-Jeghers syndrome. If you were to actually spell out Jeghers, it sounds a hell of a lot like jaguar. Jaguars for Jeghers, get it? But whoa, hold on there. This jaguar is voraciously devouring that carrion, and it definitely looks like he wants more. In order to bring Peutz back to their zoo, the zoo owners have come to lure him into their trap. The driver of the truck is holding up a stake to attract Peutz's attention. Now, why a stake, you ask? Well, this stake is here to help you remember that Peutz-Jeghers syndrome is caused by a mutation in the STK11 gene. You know, a stake for the STK in STK11. And what's more, pay closer attention to what they're holding up the stake with. Yep, that's a pair of chopsticks, because you wouldn't risk your fingers by directly holding that stake, right? Anyways, these chopsticks kind of remind me of the number 11, since the number 11 resembles two parallel sticks. Putting this together, the zoo people holding up a stake with chopsticks should help you remember the mutation in STK11, or stake 11. STK11 is a serine threonine kinase that is essential for regulating cell proliferation. As such, it is thought to be an important tumor suppressor gene that, when mutated, can predispose patients to various malignancies. We'll be discussing these malignancies over the rest of the video. Speaking of mutations, let's discuss the inheritance pattern of Peutz-Jeghers syndrome. Take a look at this big, dominant Land Rover over here. This big automobile should help you remember that Peutz-Jeghers syndrome is inherited in an autosomal dominant manner. At Pixarize, big, dominant autos such as the one shown here are our recurring symbol for autosomal dominant inheritance. This safari truck is definitely dominant. How else would you catch a jaguar? Now that we've reviewed the inheritance pattern and the cause of Peutz-Jeghers syndrome, let's go over the symptoms associated with this disease. Take a look in the back of the Land Rover, and hand me that toolbox of hammers, will you? Yeah, our zoo owners always keep these hammers around for a quick fix, especially when big cats break through their cages and escape. This toolbox of hammers is here to help you remember the hamartomatous polyps found in the GI tract of patients with Peutz-Jeghers syndrome. Get it? A box of hammers for hamartomatous polyps? Hamartomatous polyps are benign tumors arising from a mix of local tissue types. Just like how this hammer box has several different types of hammers, hamartomatous masses have several different types of tissues, including mucus, fat, and connective tissue. In Peutz-Jeghers syndrome, patients develop these hamartomatous polyps throughout their GI tract, especially in the stomach and intestines. Next, take a closer look at what the jaguar is eating. Some carrion's intestines. Aren't jaguars always eating intestines in nature documentaries? Man, I need to get out more. Anyway, these intestines are here to help you remember the increased GI cancer risk seen in patients with Peutz-Jeghers syndrome. Wait, what? I thought you said that the hamartomatous polyps from before were benign. Well, the key point to remember is malignant transformation. In other words, benign hamartomas can transform into malignant cancers along the GI tract. Like I mentioned earlier, STK11 is a tumor suppressor gene, so its mutation leads to increased cellular proliferation. And while some of this cell proliferation can be benign, a lot of cells inevitably leads to cancer. As such, patients with Peutz-Jeghers syndrome run an increased risk for developing different GI cancers, including colorectal, pancreatic, small bowel, and stomach cancer. Got that? Let's move on. All right, so what's the first thing you bring with you to look for an escaped jaguar? A safari scope, of course. Yeah, notice that telescope in our zoo owner's hands. This telescope should help you remind you of telescoping the bowel, also called intussusception. Intussusception is a classic presenting feature of Peutz-Jeghers syndrome, and it basically describes when one part of the bowel folds into or telescopes into another. This can be a really serious condition that can cut off blood flow and lead to tissue death. So, why does this happen in Peutz-Jeghers syndrome? Well, recall from your GI unit how intussusception typically needs a lead point for the telescoping to begin. In other words, there's got to be some abnormality along the GI mucosa for the telescoping to even start in the first place. While most patients don't have these lead points, Peutz-Jeghers patients have tons of them. Can you guess what these lead points are? Yep, the hamartomatous polyps from below. According to one study, nearly half of all Peutz-Jeghers syndrome develop intussusception at least once in their lifetime. A key finding in intussusception is red, currant jelly stools accompanied by abdominal pain and vomiting. These currant jelly stools are essentially stools mixed with blood and mucus and should scream a workup for intussusception. Yikes, that sounds pretty painful. I really hope my bowels don't telescope. Next, take a look at the other zookeeper in the passenger seat. Notice his necktie. You know how safari people always wear these neckties to soak up the burning sun? Our zoo owner's necktie is pink, which makes it kind of look like a pink ribbon. Let this man's pink ribbon-like necktie remind you of breast cancer. As you may already know, the pink ribbon is an international symbol for breast cancer awareness. Peutz-Jeghers syndrome is associated with an increased risk for breast cancer, which may be related to the loss of the STK11 tumor suppressor gene. Just remember this pink ribbon-like necktie and you'll have this finding down. Finally, take a look at our jaguar spots. Wouldn't you say they look highly pigmented or hyperpigmented? These hyperpigmented jaguar spots should help you remember that Peutz-Jeghers syndrome causes hyperpigmented spots around the mouth, lips, hands, and genitalia. They actually look like this in real life. This hyperpigmentation is super high yield, as you might get a picture of these spots around the lips in a patient with non-specific abdominal pain. Just know that you should be thinking of Peutz-Jeghers syndrome in your differential. Okay, it looks like our jaguar's had enough of that carry-on's intestines. Let's do a quick review before he goes for that steak. Peutz-Jeghers syndrome is an autosomal dominant disorder that is caused by a mutation in the STK11 tumor suppressor gene. Hamartomatous polyps throughout the GI tract are a classic finding, and they also serve as lead points for intussusception, or telescoping of the bowels. Malignant transformation of these hamartomas can lead to various GI cancers. In addition, a loss of the STK11 tumor suppressor gene can also lead to an increased risk for breast cancer. Lastly, patients with Peutz-Jeghers syndrome can exhibit distinctive, hyperpigmented spots around the mouth, hands, and genitalia. Well, that wraps up this segment on Peutz-Jeghers syndrome. Come here, little jaguar. Whoa, maybe next time. We'll see you next time.